it is our job and responsibility to look after the whole man. We believe that we are a holistic ministry, not just the spiritual, but also the physical. And so the health ministry here looks out for the well-being of all mankind.
I was attending a meeting at Liberty Hill with the seniors at that location, Liberty Hill Baptist Church. That day, it just so happened I got mine checked and it was at stroke level. Yes, it was like 220 over 110. Michelle, the nurse, was really outdone because it was like she didn't want me to leave before she could get me some help. She called my doctor's office and got me an appointment to go right in right away as a walk-in. I went in right away as a walk-in, and they got me on a second blood pressure medication, which at that time it brought my blood pressure down, and I've been on that medication since then, and I've been having really normal blood pressure readings. If I hadn't been at that location, talking about being at the right place at the right time, I was definitely at the right place at the right time, and so were these ladies, because if I hadn't got my pressure checked at that time, I may not be here sitting and talking with you today.
The population here is majority Hispanic in the town, and of course this church is probably 90% Hispanic, Latinos. So they definitely have a different diet. You know, most of the people here are from Mexico, so that is kind of a challenge. So of course the way we speak to Mexicans and other Latinos, their diets are different. So approaching them, we do approach in a different manner. Especially with education, especially with the rise of diabetes, obesity, it's been very helpful in addressing and helping people understand how important their eating habits are. It spurred me to promote, to have more promotion. I think we all know that we need to eat more healthy, that we need to live more healthy, and sometimes we need a little reminder every once in a while. We need a little push and nudge in that direction, and encouragement to help one another.
We've been here for 136 years. We've always been active in promoting health and wellness, education, and things like that. And so we're just trying to move forward in being more active in promoting that. Our minister is Reverend Ricky Lawson, and he's very much involved in us. Matter of fact, he's been on a really healthy weight loss regimen himself, and he's lost more than 100 pounds. So when we see him, he is definitely a great role model for us in maintaining healthy lifestyles.
It helped me to see some different ways to plan events. We've had a health fair for the past 5 years. Well, this year will be our 5th year. And some of the things that I thought, you're covering all of the bits and pieces, but it actually gave me some information on how to get some more information into those health fairs, as well as how to pass on information on the Sundays to our congregation. So using that kit kind of gives any of the churches a guideline on how to produce or how to be able to get their information out in a better way.
Since the church has become more involved in promoting health and wellness within the church, I've seen that it has spread out into the community, just our community here around us. They're asking for things to promote health and wellness. They're asking when we're going to do health fairs. They're asking us things like that. And so that just proves to me that the church is playing a part in promoting health and wellness in the community.
anything you do, as like Ms. Bayley said, educating anybody is going to always have some impact on them. You may not see it, and it may not be tangible that you can put your hands on at that moment, but even if you just have the information available and you just tell somebody about lowering their sodium intake and how to drink more water, just something very simple, those little changes go a long way. So any church looking to start a health ministry, just look at the health of your congregation now, and then notice that there are some things that you can do that you may be able to improve that. So if you can just change that one member in that church to get them to do something different, then your ministry has already made a difference.